breast and axillary. So do you normally do breast exams?
Yes.
When do you do them?
A week after my period.
And where do you do them?
Usually in the shower.
That's good. Okay. So I just want to go over a few things. So when you're in the shower, you want to inspect your breasts, make sure they're the same size. Same thing with your nipples. You want to make sure there's no breakdown or anything, no dimpling. And when you do it, you want to put your hand over your head, yeah, behind your head, thank you, when you palpate using your 3 fingers going around the breast, and you want to do it here, you want to get different musculature on that. Usually, if I was going to do this, I'd position you down and use a pillow, but I'm not going to violate you today. But I do it on both sides, the same, and I would also, palpate around your nipple, your areola, make sure there's no lumps or bumps in there, because those just aren't good. No discharge, no leakage, unless you're breastfeeding, then let's just hope it's milk. So if I can have you, I'm now going to move on to the armpit, or the axilla. So I'm just going to look at the skin. I look at her armpit, make sure it's nice and symmetrical with the rest of the arm here. There's no lesions, bumps, redness, anything like that. So I'm going to have you just put your arm out. And now I'm going to palpate for nodes. Hopefully I won't find any. But your central node is here. Your lateral node is here. Your subscapular node is here. Your pectoral node is under here. I'm not feeling anything. Your inner mammary glands are right in here. And we're going to feel your trochanter here. Okay, great. I don't feel any nodes, which is good because they're supposed to be non-palpable. And does any of that hurt? Nope. Okay, so they're non-tender as well. Now, if you could lay down. Oh, thank you. The head of the bed is raised, and I am going to just listen, or just take our pulses. Radial. Radial and brachial. I'm going to do everything both sides bilaterally, and they sound great, nice and strong. They feel great, nice and strong. They're equal. And if you could just look to the side, I'm just going to look at your jugular vein. I don't see any sort of distension, which is good. And I'm going to look at her chest, and I don't see any heaves, no abnormalities. Nothing sticking out, so that's good. And now I'm going to listen to your pulses. Sorry, not my stethoscope. I'm going to listen to her pulses using the bell. I just want to make sure there's no bruise or anything in her jugular, and I didn't feel anything. So now I can't hear myself. I'm going to listen to her pulse, her apical pulse. Sounds good. And now I'm just going to go down and listen to her aortic pulmonic, Eve's point, the tricuspid, and the mitral. And if she was a breasted woman, I'd have her lift up a little, so I can listen for her mitral. I don't feel any thrills, no heaves, and I would go back, and when I listen through, I would make sure that the S1 is louder than the S2 at the aortic and tricuspid. The Erb's point here should be the same S1 and S2, and then for her mitral valve and her pulmonic, they should have a louder S2 than an S1. I don't feel any thrills or heaves either, which is good. Sorry. Didn't mean to, I didn't either, and when I listened, I didn't S3s or S4s either, so no murmurs. But I'm also gonna have you, turn onto your side. Normally, you don't have to, it's alright, you don't have to. And then I would listen for murmurs in the mitral and tricuspid, because usually on their side you could hear it better. And, then I'd have you sit up and lean forward, and listen again for your aortic and pulmonic valves, because that's when you would hear those murmurs. So, and now I'm going to move on to your abdomen. So I'm just going to palpate in the 4 quadrants of your abdomen. Nice and soft. I don't see any ripples, any bumps, nothing. Everything is nice and smooth. Her skin is nice and symmetrical, except for the rest of her body. And I mean, I use the tangential light when I do this by looking at everything. But her belly button is intact. It's nice and flat, symmetrical on both sides. Nothing is sticking out. No masses, peristalsis, pulses. And so now I'm going to just percuss a little bit deeper, or palpate a little bit deeper. Any tenderness? No? Okay, great. I'm just going to listen, okay? Nice and active. She's hungry. And then I would listen to the aortic, her venal, her iliac, and the femoral pulses to make sure that there's no bruise. And her femoral pulse should be a +2. I would also, when I palpated, it should be a +2. I would also palpate her inguinal node too, and have her do a crunch when I do it. Palpate her inguinal node, and I should not feel it. You want to do that crunch? Okay, good. All right, good. We're good. Now I am going to percuss your spleen and your liver, and then we're gonna see if we can feel it. Okay. I'm just gonna see if I can palpate first. I don't feel any borders for liver. I don't feel any borders of her spleen, no masses, nothing like that. Now I'm gonna percuss the liver here and measure it. So I'm gonna grab my tape. So now I'm just gonna measure her liver. Go. And we are at, looks like 6 3/4 inches for her liver. Centimeters, sorry, inches. And I'm going to do the same thing on the other side. I'm going to percuss for your spleen, okay? Let me know if anything's right. Thank you. She has 6 centimeters for her spleen. Okay, now I'm going to, sorry, I lost my place for a second. Oh, look at her legs. And so, yeah, thank you. So I'd look at both legs, I'd inspect them. They are the same size, they are the same color. She's nice and warm. Freezing, sorry. I don't see any abnormalities, any enlargements on either one. Her posterior tibialis is good and strong. Her pedal pulse is good. I'm going to just do her popliteal. That's good. I do the same thing on the other side as well. And I'm also going to, I don't see any edema, and I don't see any venous patterns as well. I'm going to look at your ankles, your feet, and your Achilles tendon. Everything looks to be symmetrical as far as her ankles and her feet go. Her Achilles tendon is good. I take your sock off, but she doesn't like her feet. So I do her calf refill, and hopefully she's good. And let's see, what else do I do? Okay, I'm just gonna palpate in her metatarsal phalangeal joints. Any pain?
No.
Non-tender, and they feel good. Good. And now I'm just gonna do the range of motion. So if you could lay back for me. If you could take your leg and put it out. Okay. And if you could put it out to the side. Okay, good. If you could put it over on top. She did good flexion, abduction, adduction. And if you could push into my hand. And if you could push into my hand. Good. Push into my hand. Good. Push into my hand. Good. She's got +5 strength with her hip. And could you bend your knee and then rotate it out. Good. Now rotate it in. Good. Good. Just a rotation of the hip as well. Internal, external rotation of the hip. I'm going to inspect her knee. I like to move it. Everything appears to be good. Can you bend your knee? Good. Good. If you could take and bend your leg, and I just want you to take your heel and then run it down your, there. Okay, good. She has, and I do it on the other side too, but she has good point-to-point test. It's good coordination, and I think that's it for now. Oh, yeah, I'm just going to do range of motion of the ankle, so yeah, flex, extend, flex, internal, external. Can you rotate it in like, no? Inward, yeah, I can rotate it. Good, good. So yes, it's just full range of motion, and her strength is pretty strong too, because she was pushing against me during that. So thanks. So now we're going to inspect the musculature and neurological part of her upper body, kind of, and a little of the lower body. But if you can take your hands, put them out. Good. If you put them down, straight up and back. Fabulous. Now, if you could put them out, like that. Good job. And back. Good. So we just tested range of motion. And now if you could, yeah, go like that. And if you could push up on my hands. Good. Push against them. Good. Very good. Now, if you can put your arms out, go in, go back. Good. Now take your arm and put it up. Now put it across your body. Fabulous. We're doing some arm, elbow range of motion as well. Now I'm just gonna look at your skin a little bit and feel your joints. Nice ring. Gorgeous rings. Great. Her joints are nice. She has less sensory cap refill. That's really quick. If you could take your fingers and go like that. Good. Diamond, I don't see any clubbing, nice 160-degree angle. If you could put your arm out like this, I'm just gonna tap your wrist. Any tingling, anything? No? Okay, good. Now if you could take your hands, sorry, put them like this. If you hold it for 60 seconds, I'd ask you if you have any tingling or numbness, because that would be good. Can you squeeze my fingers? Good. Nice strength. Stop doing everything at a time. Go like this. Now resist my pulling. Good. Nice strength. +5. Wrist and fingers. Now can you put your arms out again? Push against me. I'm gonna push against you. Resist. Good. Turn the other way. Pull. Good. Okay, great. And now I'm going to inspect your elbows. Everything looks symmetrical. They're dry, very dry. Can you pronate? Yeah, supinate. Good job. Now can you touch your fingers to your thumb? Yeah, real quick. Good. Now put your hands on your lap. Now flip them back and forth. That's good. Her rapid and alternate movements of her hands and fingers are intact. Now if you could take your finger and point it to your finger and then my finger fast. Very good. That's good. Her point-to-point testing is rapid, it's fast, and it's smooth. Now we're going to test some reflexes here. First I'm going to do her bicep. Okay. Now her tricep. Good. +2. Now we're going to do her brachioradial. Everybody's getting a kick out of this. Now we're going to do her knee. Sorry.
That was real.
Well, yeah. Now we're going to do her ankle. Can you put your foot out a little? Yeah. Actually, let it go. I'll hold it. Good job. All her reflexes are a +2. Actually, her brachial and tricep are actually a +3. Now I'm going to take your foot. Okay. Okay. She's negative for Babinski, which is good. She does have a little bit of clonus. Yeah, it's a little jerky there. So you do have a little bit of clonus. And now I'm going to test the sensation of your body. Okay, so I'm going to have a sharp and a dull, and I want you to tell me which one they are. So first close your eyes.
Sharp. Dull.
Okay, I'm going to move around your body, and I'm going to do your face first, okay?
Yeah.
Sharp.
Dull.
Sharp. Sharp.
Dull.
Sharp. Yeah. Sharp.
Dull.
Good. Good. Keep your eyes closed. One more. Sharp. Good. She doesn't like to take off her socks. Otherwise, I have her take off her socks. Keep your eyes closed. I'm going to put an object in your hand. I want to know if you can identify this object.
It's a paper clip.
Good. Good. Now, keep your eyes closed. Is your finger up or down?
Up. Down.
Any toes?
Up. Down.
Good. And I'm going to, can you push your hand back up for me? Okay, I'm going to draw a number in your hand. Can you identify the number?
4.
Yeah, good job. Okay, so she has negative stereo object identification and or positive. positive, and she also has positive number identification, prosthesia, I believe it's pronounced. So now I'm going to touch you with an object. I want you to tell me if it is 1 point or 2 points. Okay?
Yep.
Okay.
1. 1. Since I feel 1. 1. 2.
Good. Yeah? No, but that's okay. I'm gonna measure that. And that is 15 millimeters. And now I'm gonna do your back. You know, I'd wanna do this on her skin part.
1. 1. 1. 1.
2. And she has 9 millimeters there. Okay. Now we are going to, I'm going to do I'm going to hit, just tell me if you feel the vibration, okay? I'm going to start with your feet.
Yes. No.
Now I'm going to do it to your fingers. Tell me when it stops, or tell me if you feel it, and then tell me when it stops.
Yes. No.
Good. Fabulous. Now I'm going to, can you stand up for me? Oh. I'm going to inspect and palpate your shoulders. They're symmetrical. If you can shrug up. Good. Fabulous. Can you push back? Good. And I already tested the range of motion of her shoulder when I had her put her hand up and put her hand across, which was good. Full range of motion there. Can you push against my shoulders? Good. Push against. Good. February. Yeah. Fabulous. Can you just walk that way for me and then come back? Okay. She has a good steady gait. And if you could put your hands out in front of you. Good. Yep. Put them out. Yep. Supine. Yep. Good. Okay, now put them by your side and close your eyes. Again. Good. So she had her eyes closed during the palmar drift and the Romberg's test, and she didn't sway for either one. And that's it. So, I also wanted to say that, you know, I would do everything bilaterally throughout the exam. I'd also obviously wash my hands before I came in or use sanitizer. When I use the otoscope, I normally would put a cover on it, but I didn't see them right here. So, I know, how could I miss it? But I put a cover on them, and during the abdominal exam, I would have her bend her knees usually, but for the video, we didn't because you wouldn't be able to see anything. So I think that about wraps it up. Thanks, Jess.
You're welcome.